So today we're going to talk about hepatitis and the effects on the body and how to live with it, deal with it, and all that jazz. Now, hepatitis is basically inflammation of the liver. When the liver is inflamed, it basically no longer does what it's supposed to. So it doesn't remove harmful substances from blood, it doesn't help the body fight infections, and it doesn't help break down nutrients in order to help sustain the body. Now you got fatigue, fever, headaches, jaundice, vomiting, stomach pain, nausea, loss of appetite, and joint pain as common symptoms. Now, hepatitis is caused by either one of three contagious viruses, and those are the most common ones. You've got A, B, and C. Now, hepatitis A is carried in feces from an infected person or from contaminated food or water which has fecal matter in it. So that's basically poop. Then hepatitis B and C are both carried in bodily fluids, but hepatitis C is especially carried in blood. Hepatitis B can be transferred in blood or semen, are both pretty common. Now, high-risk behaviors for both of those have to do with how they're transmitted, so you should avoid not washing your hands after using the bathroom, and you should always wash your hands after you change the diaper of an infected person or use the bathroom yourself. Now, prevention and detection. Now, there are two types of vaccines. You've got the hepatitis A vaccine, the hepatitis B vaccine, and there is no vaccine for hepatitis C at all. For the two hepatitis A and B vaccines, those are both spaced over 6 months. And then you also want to get regularly tested for vulnerable populations of people. Now, living with acute hepatitis, that's basically when an episode is from anywhere from several weeks to 6 months or under 6 months. Usually the care is supportive. There's not so much an antiviral regimen, especially for hepatitis A, but for hepatitis C, which is one of the most aggressive viruses, then you usually get antiviral treatment. Now, you want to stop smoking and avoid alcohol because your liver is already under strain. And with chronic hepatitis, it's pretty much the same thing. You want to have a good diet and everything, but for chronic hepatitis, it's in there for years or over 6 months and can last your whole life. And that can lead to liver cancer. About 25% of people with hepatitis C don't get chronic hepatitis. The other 75% do have chronic hepatitis, and that leads to liver cancer, cirrhosis, liver failure, and all that jazz. So hepatitis C is definitely the most aggressive type. Now, for hepatitis B and C, you might be prescribed antiviral medications. What you want to do is make sure you stay on a schedule and keep going back to your doctor for checkups. And thank you for watching.